Hi guys, so Matt Hancock, the health secretary, delivered a press conference where he explained which areas are going into tier 3 from tier 2. Now, I had feared this was going to happen because of the new tiered system and the lockdown that was ended much too soon. But I'll come back to that later. Let's hear what he had to say.
Once again, the spread of this disease is not even across the country. And there have been sharp rises in South Wales, London, Kent, Essex, and parts of the east and southeast of England. In some areas, the doubling time is now 7 days. And this rise has been amongst people of all age groups, not just school-aged children. And I'm particularly concerned about the rising rates in the over 60s and the number of people in hospital, which is also rising. And that's even before we factor in the increase in the last week's rates. And we know through painful experience that more cases leads to more hospitalizations and, sadly, more deaths. To think that this link and this chain is broken is wrong and dangerous. We've seen it time and time again elsewhere this year. When cases rise, pressure on hospitals mounts, and so too then, sadly, to the number of people who die from coronavirus.
Now, I talked about this before, how if you don't maintain a lockdown, a significant lockdown, you're going to see cases rise again. Now, Boris Johnson and Matt Hancock decided we're going to end the lockdown, the new lockdown that was introduced after pressure from Keir Starmer. We're going to introduce this lockdown we're going to introduce this lockdown, and then they ended the lockdown on an arbitrary date, the 2nd of December. Now, instead of actually ending the lockdown when the cases had come under control, they decided, no, we're going to end the lockdown on the 2nd of December. That's almost 2 weeks ago. And now you're starting to see the numbers increase again. The tiered system is not working. You had to introduce a lockdown. You ended the lockdown before. You introduced a new tiered system. The tiered system wasn't working, so you had to introduce a new lockdown. Now the tiered system has demonstrated not to be working once again. You need to have a strict lockdown. You need to enforce mask wearing. You need to enforce rules to stop people from mingling, from organizing groups. And then you need to have a robust test, trace, isolate system, which the UK doesn't seem to be having at the moment. That's what you need. Going forward, you're just going to have the same problems once again. This tiered system is insufficient. It was introduced 2 weeks ago, and now you're starting to see the results of it failing. And we haven't even arrived at Christmas yet. Christmas is going to be a disaster. You're going to see a huge spike at Christmas. The tiered system is not working. You need a full lockdown. A lockdown that, and I'm not going to say how long it would take, because it takes whatever it takes. You get the numbers right down, and then you have a robust test, trace, and isolate system.
To stop this, we need to act fast. And I can tell you that because of the testing and surveillance system that we've built, we've also identified a new variant of this virus, which may be associated with the faster spread in some areas. Now, we deal with this variant just like we do with all the others. And this underlines how important it is for us to be vigilant.
Now, don't panic. Well, not too much, because this new variant doesn't mean that they don't have a vaccine that will work with it. The news seems to be that the vaccine is sufficient to deal with this new variant. So that's not the concern. The concern is the testing, as far as I know. The testing, you may need new testing kits to deal with the new variant. So you will need to increase the testing. You'll need to test people for both the original coronavirus and this new variant. Or maybe sufficient testing will be capable of picking up both of them. I don't know. Now, this is new information and we don't have much on it at the moment, but it doesn't help the situation. But it is important to remember that, as far as I know, that from the scientists, they say that this new variant isn't more deadly than the current one.
The vaccine is being rolled out, and it's wonderful to see that tens of thousands of people have already had their jabs, their first jabs. And it's also very good to see that the vaccine is being now rolled out as of today across by GPs in England and also to care homes in Scotland. Help is on its way, but we're not there yet. To control this deadly disease while the vaccine's being rolled out, we all have a role to play. Everyone should minimize their social contact, because that's how we can control the spread of this disease. And turning to London and South and West Essex and South Hertfordshire, in these areas where we've seen these sharp exponential rises in the past week, we've taken swift and decisive action to protect the NHS and to save lives. Even ahead of the formal review point on Wednesday, we must act now. So from 1 minute from midnight on Wednesday morning, these areas will move into Tier 3, the very high alert level.
Now, but the problem is, how did they get out of Tier 3? This was the problem before. Many areas moved from Tier 1 into Tier 2 into Tier 3. And they had remained in Tier 3 until a new lockdown was implemented. How did people get out of Tier 3? They can't, because it's out of their hands. If people are following the rules, so if people are not following the rules, then you need to reinforce the rules. If people are not washing their hands, you need to enforce washing their hands. This is not, I don't believe this is the problem of the people. This is the problem of the enforcement of these rules. This is the problem of the government trying to balance the economy and public health. And of course, both are sacrificed. Both are suffering. I've said before, you need to have a strict lockdown and then implement your test, trace, and isolate. Now, other countries are starting to see cases rise, but because they haven't been following test, trace, and isolate.
I know that this news is not what people want to hear. It's a blow to so many people who've made plans and to businesses who'll be adversely affected. But we know from experience that the best thing to do in the face of this virus is to act fast, not to wait to see its growth continue.
Not wait to see its growth continue. When you were asked by Keir Starmer to implement a circuit breaker, a mini lockdown, you resisted. Why did you do that? Because you were afraid of your backbenchers. You were afraid of the lunatics within the Conservative Party who didn't want any type of restriction. I was actually wrong before where I said that the government are trying to balance public health and the economy. They're actually trying to balance sanity and insanity. Sanity as in we need to do something, we need to take strict measures, and the insanity is the likes of what's his name, Sir Desmond Swayne in Parliament, who don't want to do anything, who believe this is all just some sort of joke. It's all a scam. It's an attempt by the government to strip away people's liberties. This seems to be the situation at the moment. And we haven't even arrived at Christmas where you're going to see a massive spike because people are not going to follow the rules. And we don't even know what the rules are going to be. The government haven't laid out any rules yet, as in what's going to happen in each of the tiers surrounding Christmas. As I said before, the government are not dealing with this correctly. Many governments, and I'm not just focusing on the British government here, but many governments are not dealing with this correctly. You need to have a strict lockdown in order to give you time and to protect your healthcare system, to give you time to test, trace, and isolate cases. I feel sorry for those who are now moving from Tier 2 into Tier 3. It seems to be a type of limbo, because once you're in Tier 3, there doesn't seem to be a way out. The only way out so far has been another lockdown. And SAGE and other scientists have been talking about another lockdown on the way, probably in January or February. And at this stage, it may actually happen before that. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?